Time to round up a big story from the week. United Healthcare says it's facing major financial losses and may have to exit the Affordable Care Act's exchange program. The country's largest health insurer is scaling back its marketing of exchange plans and says it will evaluate its offerings of Obamacare during the first half of next year. Over 500,000 Americans could have to find other coverage. The announcement is the latest in a string of bad news for the president's signature health law. So what would a United Health exit mean for the future of Obamacare? That's our topic this half hour. We want to hear from you. You can weigh in on our Fox 26 Facebook page. You can also send a tweet. Use the hashtag Fox26forlife. Joining us live in the newsroom is our panel led by our senior legal analyst, Chris Tritico, our news analyst, Mustafa Tamiz, and public policy analyst, Jackie Bally. Good morning again, guys.
Good morning.
So what does this mean?
You know, United Healthcare and the other major insurers could do for the Republicans what the Republicans can't do themselves and bring down this law, because if there's not enough plans to sell to those who are required to get it, they may have to actually modify this law. The interesting thing about United Healthcare is just 1 month ago in a conference call with investors, they were touting their work with the exchanges and how pleased they were with the exchanges. 1 month later, they're saying we lost over $200 million and may have to back out in 2017. I'm not exactly sure where this goes, but Jackie Bally, I think that one of the primary reasons United Healthcare is mad is the government announced that they're only going to pay 12.6% of their expected payments through the exchanges to make up for losses. And don't you think that's what United Healthcare is really mad about?
That's one of them, and they also claim that they are $425 million in debt, based on the fact that they cannot cover expenses. They said that they were not prepared for the level of expenses that they've received, and the premiums that they're collecting is not enough to cover. So they're claiming to be in the red $425 million. So that, and based on the fact that they're only getting the 12%, is why that they're threatening now to get out of Obamacare. And you're correct. This is exactly what Republican leaders said why they were not in favor of Obamacare, and now it's actually coming to fruition.
Well, that's not what I said, but close enough.
Well, it sounded like that's what you said.
Well, look, you know, 60 times we tried to repeal Obamacare. Supreme Court cases were launched against that loss against it. United Healthcare represents less than 6% of the total number of people that have health insurance through the exchange. Over 10 million people have it, and United Healthcare is about $550 million. This is basically a tactic for them to get a higher stock price. They believe that by saying this, they create the rhetoric enough that points a finger at Obamacare rather than mismanagement on their side. This is all about stock value. It's all about keeping the bonuses for the executives. In the end, they will end up keeping the exchange because it is the best place for them to sell insurance. It doesn't cost them anything to sell it, and over time, this is going to be profitable. It's like all insurance products. Over the long haul, insurance companies always make money.
The point that they're making about the 12.5%, I think, is a valid point. You said you were going to fund part of this for us, and now you're only giving 12.5%.
You know, so in essence, they're using this as a tactic to negotiate with the federal government rather than making accurate claims. You mean to tell me that the CEO might be lying? Oh, I'm so surprised.
Let me go to Sally. She's monitoring our social media.
Okay, we've got a couple different opinions on Twitter this morning. Chris says, referring to United Healthcare, they undercut the prices trying to gobble up as many people as possible and got burned. There is very little money in Obamacare. Christina, who's a frequent financial contributor on some of the networks, says Obamacare was broadly and intensely opposed by Americans, yet elites rammed it through anyway. And she adds, in a nutshell, we've destroyed the private healthcare market and what's left will be Medicaid. What do you guys think about that?
Well, there's a lot of people who think the private healthcare market was what was destroying medicine in the United States, but that's not for today. One of the things that we've been seeing insurers do through the exchanges is raising the deductible amounts higher and higher and higher, and in that way making their money back because people now have these policies through the exchange that are really catastrophic policies.
Yeah, raising deductible amounts higher and higher, having fewer and fewer options as far as hospitals, as far as medical facilities, as far as doctors. You're also hearing administrators and doctors who are also complaining about these high costs that are now associated with Obamacare. So as much as people from the left would like to say that this is just rhetoric and that this is just a way for insurance companies to make money, you also have the administrators and the doctors who are saying it's also taking out of their pocket and it's becoming almost impossible for them to make money.
By raising the deductible to an amount where you only can use it for catastrophic insurance, the insurance company does make money, don't they?
Well, it's a short-term view, right? But when you raise the deductibles, people don't go to their doctors to get preventative care and then end up spending more money in the healthcare system. The insurance companies have had it backward for years. They feel like if you don't use the insurance, that it would cost them less. The reality is if you don't use it for preventative care, long-term, it will cost them more, therefore cost the system more.
All right, we're going to leave it right there. Quite frankly, Sally, the fate of Obamacare really rests in the next presidential election because if the Republican wins, that law's gone.